It is the popular saying that a healthy society is a wealthy one. On the Great Mind program, medical experts are available to provide solutions to various health challenges. You desire greatness in life. Successful men and women in the society are available on the Great Mind program to reveal to you the secrets to their greatness. The Great Mind of Nenti Oshogbo is a watch for all. Meet me on the program every Sunday between 3:30 and 4 p.m. Happy Sunday to you all. This is another edition of the program, The Great Mind. I'm Bola Olayode. The personality we are celebrating on the program this week is the pioneer commissioner for culture and tourism in Osun State, popularly known in his lifetime as Obaf. Meanwhile, on the S segment, our G centers on the measure being put in place by Osun Health Insurance Agency to ensure that the healthcare providers perform optimally. Osun Health Insurance Agency, an organization established by law purposely to enable the residents in Osun State to access qualitative healthcare free from financial hardship, is a public-private oriented organization. In its discharge of duties to the members of public, Osun Health Insurance Agency ensures that the enrollees of the agency and the vulnerable people that are benefiting from its free healthcare components are given preferential treatment above others at the various accredited hospitals across the local government areas of the state. Since efficiency and integrity are among the core values of Osun Health Insurance Agency, it means provision of qualitative health care for the people of Osun State under the administration of Governor Adegboyega Oyetola. Lots of measures are put in place by the agency to ensure the full compliance of the healthcare providers to the laid down rules and regulations in ensuring that the enrollees of Osun Health Insurance Agency and the vulnerable people who are benefiting from the free healthcare component of the agency are treated like kings and queens. Executive Secretary, Board of Directors of Osun Health Insurance Agency, Dr. Adeniyi Ogini, explains the reason for the action of the agency.
You know, the healthcare service delivery is a contract between the provider and the person that is procuring the service. And we serve as the agency that regulates the quality of the service that is given to our enrollees. Between us and the HMO, the third-party administrators, and the service providers, the healthcare providers, there is a service level agreement that we signed. And this is to the effect that they will provide quality services to our people. We have our tariff with which we pay them. We have our essential medicine list, which they must have at any point in time, which they must give to our patients. And they must also not ask for monies that are not authorized from our enrollees. Any act that is different from this will constitute an infringement. And of course, once you commit an infringement, then the next thing is there will be penalties that are attached to that. Now, the way we are ensuring that we enforce that is by, number one, having a quality control protocol, which we have communicated to all our service providers. And after that, we do quality inspection visits. During our quality inspection visits, we ensure that the requisite infrastructure, equipment, medicines and consumables that are needed to provide good service to our people, our enrollees, are present within the hospital, including the personnel, to ensure that the service delivery is undertaken uninterruptedly. That is one. Aside from that, we also inspect the books We want to see what is the enrollment pattern like. We check from the the panel list which we have sent to them. Then we look at the encounter pattern. How many of the enrollees visited this hospital during the period under review? Now we want to see the frequency with which some come to the hospital. We want to see whether there's a particular pattern of disease that's more rampant and things like that. We check all of that when we go on our quality inspection visits. And then we also ask anonymously from enrollees what is their feel, what's their impression about the quality that they are receiving. Now, when we finish the quality inspection visit, if we have found that a particular healthcare provider is not doing what he ought to do, the first time we have that report, we are going to give them a warning that where we have observed so and so on our quality inspection visit, and we want them to do correction. If the same thing happens the second time, then we will give a second warning. By the third time, we slam them sanctions. That is as contained in the operational guideline. We have a guideline that that guides our operations. And when a healthcare provider registers with us, after our accreditation of the facility, we give them, as part of the package, we give them a copy of the operational guideline, we give them a copy of a prescription sheet, we give them a copy of the referral forms, we give them all, and including even this, we give them this. If you look, this document that you are seeing, you see this document is actually the standard treatment guidelines and referral protocol. This document contains the diseases that we treat in our benefit package and how to treat them. Standard protocol for treatment. So if you are going to receive treatment in Ifetedo from an accredited facility, and you are receiving treatment in Osogbo from an accredited facility, or is accredited facility, the protocol is the same. This is how you are supposed to be treated. That's how we are brought. This is to provide knowledge for those who are handling our patients, to ensure that they standardize treatment, so that it's not as if you get here, they diagnose malaria, something that is not malaria, they diagnose as malaria, and you get somewhere else, they diagnose as typhoid fever. No, the diagnostic criteria are contained here, and the treatment modalities are here. This is part of what we do to ensure standard in the delivery of service under OIS. If you look at this, these are benefit package. The benefit package and drug service tariff. This contains the drugs that we're supposed to use, and it contains the conditions that are covered in our benefit package under our scheme. So once you go out of this, you are warned. And if you go the second time, the warn you the third time, we slam you sanctions. The sanctions could be beginning from making you pay a fine, and then sometimes if what you have committed is very grievous, we can also completely delist you from the service providers, because we want to win the confidence of the people of this state to this scheme. We want to ensure that we change the communication, the narrative. The narrative has been that every government agency, government scheme, they don't work well. But we are a quasi-public organization. We are both private-public, because we take money from the private sector to invest into this scheme. So it's not just public. So we operate with the public sector efficiency philosophy to ensure that we're up to the task in this game that they've given to us. That's what we do.
Dr. Shina Igbalaye is Director, Standard Quality Assurance for Osun Health Insurance Agency.
Accreditation process, it's one of the measures being used by the agency to select qualified hospital facilities that will partner with the organization, with the agency for service provision. Now, we have a number of measures, a number of things that we put in place. First thing is for the prospective healthcare facilities to express interest in partnering with the scheme. And to that extent, what they do is to obtain a form and then after obtaining the form, with a certain amount of money that will be paid into the agency's account, and after that, we'll give them an application form, after which they would provide some documents that will be attached to the form. Now, when this is done, the agency will set up, we have an accreditation team led by the executive secretary that will now pay a visit. We call it accreditation visit to the hospital. Now, by the time we get there, before then, in order to strengthen the quality system, we invite the leaders in various fields. For example, we go with NHIS, the critical stakeholder. We go with, apart from NHIS, we also invite the directors, the various directors in the various ministries and entities. So in the various departments within the agency, we also go. And then, of course, the accreditation department itself, then we also go. So by the time we pay a visit to the facility, what we do is to inspect based on our checklist. We have an adherence checklist that we do. Based on that, we now pay a visit to the hospital. We now need to score. We have a scoring that we do from time to time. Now we visit. We have management system under the checklist. Apart from the management system, we have personnel. After the personnel, so we also need to check the documents that were submitted during with the application. Now, these documents, we will need to cite the original, of course, part of which is the document that we need to know how qualified the system is, how qualified the facility is, and if they are registered with the Ministry of Health, if they are registered with NHIS, if they also have CS registration. All of these are documents that we need to cite. After this, we now need to look at the number of doctors working in the hospital, number of nurses, the personnel generally. After this, we try to look at the infrastructure that they have, of course, whether they have generator, whether they have ICT, computer systems, whether they have the disposal system, waste disposal system, and all of this. We also check their laboratory. So all of this, we have a scoring guide that we will know, and then after scoring, now we come back to the agency. We review all of this, and then together with the score that we have from the individual that make up the team. So after this is done, then the final approval, then we throw the appropriate recommendation, and the ES give the final approval. So now beyond this, so it's a rigorous exercise from which all of these are geared towards having a standard facility that we can partner with. It's not just any facility. So by the time they are able to scale through this, then we partner with them, after which they give them the certificate of registration, we give them the certificate of accreditation, and then we, of course, we bring them on board, and then our enrollees are free to now choose them for us to partner with them where they can be accessing the care. Now, apart from this, we have HMOs. The HMOs are also there to check the services that are being provided at the facility. Now, all of these are some of the things that HMOs will go there. They will pay quality assurance visitation. They will go there to check the services being rendered to the enrollees. They also go there from time to time to look at the environment, the services being provided, then the infrastructure. All of these are things, and they submit quarterly report to the agency. Now, apart from that, also they are free. The enrollees are also free to call any of our lines. We have call center unit. Apart from that, we also have our social media handles, and apart from that, they can also walk in to come and actually make a complaint about whatever, about the services that are given to them at the facility. So these are measures put in place to actually checkmate infractions, to checkmate poor service delivery at the facility. And then, of course, we have had a number of cases, and we have had to call the hospital facility to action, to call them to question. Apart from that, we have had calls to delist one of the hospitals. In fact, not even the only one. We have had calls to delist about 2 hospitals for infractions committed in the course of trying to provide service to our enrollees. I want to say at this level that our enrollees, we treat them as kings and queens, and this we have made known to service provider that enrollees we take them, they are cardinal stakeholder, and we do not want anything that will jeopardize the system, be it to probably demarket the scheme or probably give unwholesome service to our enrollees. So these are some of the things that are doing to actually keep a viral scheme and to make it our scheme a very good one.
Director of Programs, Osun Health Insurance Agency, Farm Olazu Komisumono, also explains the reason for the measures put in place by Osun Health Insurance Agency to ensure the compliance of the healthcare providers to the laid down rules and regulations.
For our healthcare providers, number one, they applied, and when you applied and you are successful, you're given certain rules of engagement. We signed service level agreement with them, and most of the tools they needed to know the do's and don'ts of the agencies are with them. In fact, there are some manuals, we call one standard treatment guideline, given to them, that when you are treating headache in Garage Olode and you are treating headache in Ikirun, it follows the same protocol under our scheme. It's given to them. And under this scheme, one of the things we want to eradicate is people spending out of their pockets for health services. If you now have an healthcare provider that is taxing people we want to save from financial embarrassment, it's not going to go down well with us. And there are stages of sanctions. First warning, second warning, and sanction will follow. And don't forget, we are in Africa, we are in Nigeria, our level of capitalism is so high, people don't want to deviate from their immediate past, even if they are getting something bigger than what they used to do. I want to tell you that there are facilities with 1,000 enrollees, and we are paying on each of these enrollees per month, whether they go to that facility or not. Understand? And when they submit their encounter data to us, you find out that out of that 1,000 enrollees that is they are saddled to take care of, they will not be able to attend to 200. So the remaining ones is their own. We are not after that. So you cannot keep faith with such a system. I know we are going to get there one day. But one thing is that periodically we call something quality inspection visit. We'll pay it to them, look at how they are. Then our enrollees do call in. How do you see your facility? You call into our call center and we'll know what's happening there. And we'll take a move. There are specific on-the-spot checking for certain facilities that we have been doing. And they have been complying to our corrections. They have been taken to corrections. And some have been edged out because they feel too big to align with our rules.
You are welcome to the segment where we celebrate the achievers in the society. At the beginning of this program, as I said, we are celebrating the pioneer Commissioner for Culture and Tourism in Osun State, Honorable Obafemi Fagbola, popularly known in his lifetime as Obaf. We are celebrating him because he succeeded in leaving his footprint on the sand of time while he was alive. The one-time Commissioner for Water Resources and the pioneer Commissioner for Culture and Tourism in Osun State, Honorable Obafemi Fagbola, popularly known in his lifetime as Obaf, was born 59 years ago in Ile-Ife. His late father and mother ate respectively from Omishore compound of Moya and Fegus compound of Magbara, Ile-Ife. He started his elementary education at SS Peters and Paul's Primary School, Iremo, Ile-Ife, and proceeded to Ife Anglican Grammar School, from where he obtained his ordinary level certificate. He later gained admission to the University of Ife, now Obafemi Awolowo University, where he obtained first degree in English. He also obtained Masters in Business Management and Masters in Philosophy, respectively, from the same Obafemi Fagbola University. Being a self-made man after graduating from university, Obafemi Fagbola engaged himself in business instead of looking for a white-collar job.
Traveled abroad, came back, became self-employed. I was into car business. I was importing cars into Nigeria and doing some other business, legitimate business.
The late Honorable Obafemi Fagbola, who was once the chairman of Ife Central Local Government, explained the genesis of his career in politics.
In 1996, precisely, I came back to Nigeria. I contested as the chairman of Ife Central Local Government. The election I won, with the support of God, His Royal Highness Obaf Chief Ajayi Bonfo, and Professor Wale Oladipo. Prof is the chairman superb now. Those are the people that prepared me politically. Himself and Baba Bonfo. We call him Baba Bonfo. That is, he lives, he's still alive. He lives in Arubid in Ilefe. Those are the people that prepared me for my political challenges.
The late Ajayi, popularly known in his lifetime as Baba Bonfo, was the political father of Honorable Obafemi Fagbola. He described Obafemi as a decent and intelligent chap with good vision.
Fagbola, ọmọ mi dáadáa ni. In-law mi ló jẹ́. Tó jẹ́ ìyá ẹ̀ ló jẹ́ ẹ̀gbọ́n ìyàwó tèmi. Nílẹ̀ láti lẹ̀ ọmọ dáadáa ni. Èmi mo níjókòó nínú ẹgbẹ́ òṣèlú. Ìgbà yẹn èyí ṣe pé àṣẹ kan wà a máa ń tẹ̀lé báwo lèèyàn ṣe rí, báwo lèèyàn ṣe lè wúlò, báwo lèèyàn ti lè ṣe. Ọ̀dà alága káńsù yẹn ọ̀dọ̀ ọ̀nà mú ọ̀dẹ̀ dìbò èsì má kàrúrú dìbò ìbò rẹ̀ níwájú ọlọ́run àti òwòlé ńlọ́dẹ̀ ti bẹ̀rẹ̀ sí i.
Late Obafemi Fagbola, former Commissioner for Culture and Tourism, who was a happy family man, unpaid the memorable events in his life.
I went back after my tenure. I went back to my business. Then the then governor, Bisa Kade, came to government. I was appointed as an executive assistant on business matters. As luck would have it, Prince Olagusu Yunyola came on board. I was appointed, when he was during his election, during his primary, I was in charge. I was the supervisor for his primaries. I was in charge of all the primary election. I was, all the elections. His primary election happened, thrice. We did it thrice. Twice in Oshogo and the last one in Abuja before they finally gave up. As not the fact that he was God chosen anyway. So when he came on board, he made me the special advisor, youth sport and culture, a position I enjoyed so much, and I brought life into the sporting activities of the state. Later, I was upgraded. I became Commissioner for Water Resources. Where I did everything humanly possible to make sure that, there was uninterrupted water supply in the state. Because everything being equal, we make sure, courtesy of His Excellency, President Olagusu, that water was available throughout. I was in charge of rural education too, and we tried everything possible to make sure that nearly all our rural areas were electrified. You know, the program is still on. The website was created when I was the Commissioner for Water Resources. We did a lot, you know, in that area as well, trying to reach the grassroots in hygiene, area of hygiene, water supply, sanitary, and loads of others. You know, I was always in touch with foreign donors. You know, they were forthcoming, they did a lot for us, you know. The ADB came, we came first in their rating, you know. So quite a lot of things were done when I was in Water Resources.
The pioneering Commissioner for Culture and Tourism unveils the memorable events in his life.
When I left university, when I graduated, was a memorable one, you know, because, you see, I grew up among my cousins. You know, they forced them to go to school. You know, but out of them all, I thank God today that, you know, at least I made it to school. I mean, I made it very well, you know. So, you know, it's a memorable thing to me. And, you know, that brings back the memory of my grandfather too, late Chief Johnson Omishaki Omishore, you know, he was a father indeed. May so rest in peace. He did everything to make life worth living for me.
While Honorable Obafemi Fagbola was alive, he offered this piece of advice to the politicians.
You see, what kills people is over-ambition. When you're looking too far away when you're looking too far away into the future. God owns the future. Leave your focus. Just be prayerful. Make sure what you are doing today, do it well. Do it and make sure that you touch the life of a lot of people. Let tomorrow be in the hand of God. You know, so I don't really have any focus than, you know, I'm focusing my God to give me direction.
May Almighty God grant eternal rest to the pioneer Commissioner for Culture and Tourism in Osun State, known in his lifetime as Obaf, and watch over the people he left behind. With that, we ended this week's edition of the program, The Great Mind. Next Sunday is another date. God willing. Till then, stay blessed.